weren't thinking about anything related to the pandemic except that it was, across the Pacific and in Asia. And, we're hearing some rumblings about people getting sick on cruise ships. And, then ultimately we had a case in Vacaville, I believe, that was a community spread. It was the first one in the country. And apparently a hospital up there didn't test a patient who felt she had the virus, the conditions related to the virus, and released her. And then she wasn't tested for another 4 or 5 days. And then she tested positive and was rushed to UC Davis Medical Center. About a day after that, we started getting, some reports of, people coming in being, forced to come back from their semesters abroad in Italy and other places in Europe. That was something that was done by the universities and the I guess the State Department did that as well. But then we were just, kind of like all of a sudden it cascaded. And, for the last 2 weeks, we've been in this cocoon of just coronavirus coverage. Everything from how people were stocking up, people were panicking a little bit with the hoarding, trying to find people buying toilet paper, which was kind of like odd and a little bit funny at first, but then all of a sudden it kind of took a little bit more of a strange turn with everything being hoarded. Ever since then, we've been just kind of watching the progression of places being shut down. Got a lot of advice from the Seattle Times that we shouldn't take this thing lightly. I guess their newsroom shut down before ours did, and we ended up going work from home just a little under 2 weeks ago. And for the past week entirely, we've been working from home. Mostly the reporters and the editors, but because the photographers have just a ton of, we have to be on the road and remote all the time. So we're actually out and about. Does that answer your question? I can't hear you, Kat.
Yes, sorry, I muted myself so I wouldn't interrupt you. Paige, would you like to go next and tell us what it's been looking like in Seattle? I know you guys got hit first and are pretty knee deep in it right now.
Is my sound good?
Yep, I can hear you.
So we got the first confirmed case. We had the first confirmed case here, but that was last month. And then at the very end of February, we heard that there were 2 additional cases, and then there was one confirmed case at the Life Care Center in Kirkland, which is one of the cities I cover. So that was a Saturday, and we really haven't stopped since. It was 1 death, and then it was 2, and then suddenly it was 10, and it's just been really doubling almost every single day in terms of cases. So it started out in Kirkland, but then it spread to other nursing homes, other areas. So there really hasn't been a lag since then. We went a full remote newsroom about a week and a half ago. Some people were working home before then, but others were still coming in. But it's been about a week and a half of full remote since then.
And Kent, would you like to share what's going on in your area?
Sure. Well, it's about the same timeline as what Carlos described. We had our first cases come in off of cruise ships. One was transported, I believe, to one of our hospitals here that was tested positive, and then we got 2, and then we now have 9 confirmed cases in the last 2 weeks. And unlike Seattle, where they have the drive-up testing, we are just in the very early stages of that around our hospitals. I've been out to a couple of the sites, and there's just, most of them have to have appointments to be tested. So it's kind of a sporadic thing. So we're seeing our numbers go up now, and but it's like I said before, there's so little testing now that it's a false sense of security that the numbers haven't gone higher. and we're all kind of waiting for this rush of positive test results. And it's not a reason to panic, simply because there's just more testing that will be done. We've been going nonstop probably for a good week and a half to 2 weeks. They shut our city down, Sonoma County down, 2 days after the Bay Area, a day after the general Bay Area went down, and the impacts were immediate. There's not a lot of people on the street. We had panic buying in all of the stores. For some reason, people want toilet paper and paper towels, and part of the problem with this going in and doing these assignments is that you have to go into these stores and photograph the stuff that is going on, and you have to take those precautions. So basically, like Carlos said, we're just kind of the photographers are already outfitted for all this stuff, and our newsroom is all remote now, except for some of our editors. But most of the reporters and photographers are remote now, so we're just kind of hanging on. Every day there's a sense of disaster every day as you get going, and by the end of the day you're exhausted, and then you sleep, and then you get up in the morning and you're revitalized, and then you go right back into it again. It's like covering a disaster every single day. It's starting to level out a little bit now, but we expect that we're going to have more people being tested positive, just simply because of just the way things been going around the world.
All right, thank you so much. So related to what you guys were just talking about, could you describe a little bit about how the workflow in your newsrooms has changed, what challenges you guys have encountered, and how each of your newsrooms have dealt with it? Because I'm sure a lot of newsrooms who are about to go through this are going to face a lot of the same challenges. Can we start with Carlos?
Sure. For the most part, we're just extending services we already had in place using apps like Slack that allows us to be, communicate without being in the same room or even in the same part of the newsroom. It's just that we're now doing it from our homes, our living rooms, or whatever. And in some instances, people's kitchens. You do it wherever you can. From your car, from any place you have an internet connection, you're able to connect and work remotely. We had always had the option to work remote from our cars and from our homes if we needed to, because of the change of space in the newsroom. But to see copy editors and page designers and editors being able to communicate remotely using apps like Slack or, your basic, texting options on your phone, group chat, that kind of thing, really made, we did a test run about 10 days ago and it worked really well. And it was just a matter of, diving into it completely. When we finally realized we couldn't keep going back to our newsroom in San Francisco, it was just too much of a risk to be out, commuting and out in public like that. And even in an enclosed space where people come from different areas, it just was too risky. So, the communications and the budget talks, the live updates, little, news hints, news tips coming in are all shared on Slack in different channels. One specifically called the virus. It's got the, another one is virus ideas for projects we can do related to the coverage. And it's all worked pretty well so far. The photographers can share, breaking news video on that channel as well. So it really does implement, it really does dovetail well into our entire operation.
Great, thank you so much. Paige, has it been similar in your newsroom? Are you guys using Slack? What other tools have you guys found to be useful?
Yeah, we are using Slack. We were using Slack before all of this, but it was sort of on an optional basis for people. And this has really made it paramount, mandatory even for everyone to be communicating. And so since we have been remote, I think the biggest adjustment is just that no one is in the newsroom. Before, there were people there sort of running the mothership, and now it's just figuring out where people are. It's also been very kind of, for me, actually more of an adjustment because I'm often, in other places, but the fact that there aren't any businesses open anymore, so there were no coffee shops for me to file from. I had to file everything from my car if I'm there, or I have to be in my apartment, which is actually, I think, kind of an adjustment of not really being able to go places. So I've been doing a lot of work here, which is weird. And my dog's been helping. She wanted to say hi too. So I think that's been the biggest thing, and figuring out. So communication's been huge. We made a list of where everyone lives and where everyone is, because that's been kind of difficult to figure out. We have a Google Doc of pretty much everything, and it's, I think, like dozens of pages now. It's kind of ridiculous, and we have a whole lot of different Google Docs for different things. We're definitely still kind of running on a oh my God, all hands on deck. So organization-wise, it's not probably what we would like it to be, but we're still managing to get stuff out, but certainly not as organized as we normally would.
All right, thank you so much. Kent, same question. How have you guys been communicating and running the newsroom? Are you fully remote?
Yeah, we're pretty much, the photographers have always been kind of remote, and the reporters most of them have laptops, or they're working from home doing phones, things like that. We have Slack channel that we use. We also use we use our email quite a bit. We also we use all different types of communication, and I would suggest that it's coming your way. It's just not a matter of if, it's when. And if you can test these things now and get this stuff down to a science, you're going to be much better off. I know that Seattle has done it for a long time, and they're just kicking everybody's butt. I mean, they're just doing a great job. And I've kind of looked at their coverage like, okay, that's what I could be doing. But yeah, we're pretty much all the photographers are remote. We all have cards that we can send from. Most of us work out of our homes or out of our vehicles, because it's the only way that when you're on assignment you can do that. And then we do the phone app to communicate at our meetings 3 times a day for me, because I'm sitting the desk this week, shooting and sitting the desk. I did it 3 days this week, and so I'm communicating with them constantly, probably 5 to 10 times a day. I'm on the phone with them, on the phone with photographers. The communication has been really good, but I wish we had started earlier with the remote thing, but it just caught us, obviously we knew it was coming down the pipe, but we've got it all pretty much ironed out now, and we're kind of humming right along. There are problems every now and then, but for the most part, we're getting it done. Wednesday, when we shut down, was a really, really long day, and we had to kind of figure out the bugs, but seems to be working okay now, and everybody's getting along really well.
Great, I'm glad to hear that. Carlos, did you have something to add?
Yeah, I did actually. I think that one of the things that really prepared us for this was the inordinate amount of wildfires we've had to cover lately, and earthquakes, and we've had disaster planning in the works for years based on the big one, as they say, when this large earthquake that we've been waiting for 50 years. But in the last couple of years, we've had some of the most devastating wildfires in the area, and I think just that little bit of planning for what's coming next, because we're not anticipating those slowing down at all, has really helped. I don't know if it was planned or not, but a few years ago, the company started changing out the big desktop computer that sat, on your desktop like a monolith, and started replacing them with laptops that everybody could just plug their monitor into. So everything they needed, they could literally pick up and walk out with. And that was just something that, I don't know if they, just fortuitous or, whatever, but it's really helped out quite a bit.
Great. So going into our next question then about equipment is, what new or more complicated safety procedures are you guys undergoing every day to make sure that you're safe? Are you sterilizing equipment after every assignment? Are you only interacting with the public outside? Kind of how have assignments changed in the current situation?
Are you asking me or?
Yes, yes, Carlos, go
Oh,
ahead.
okay, sorry. You know, it's tricky because there are times when you're out there, and I mean, for me, it's hard not to shake people's hands or be you know a little bit more personal, and getting in close with the camera to be a little more intimate. It's tricky, and I found that I'm a little bit more concerned now about even putting my cameras down when I'm on an assignment. And just the other night, I was photographing the closing of some of the last bars in San Francisco, and I was at this place that on any given day might have been not quite as clean as it should have been. Um, I feel terrible saying that, but I started to really kind of like question whether I should set my second camera with my long lens down in that place. And just because you don't know if there's the people coming in there might have been exposed to it, or I might have been exposed to it, and all of a sudden you're picking this camera up and they're right in front of your face, right in front of your nose and mouth, and it's a little bit disconcerting to start doubting like that. And so I've been carrying around a one of those tubs of Clorox wipes and trying to disinfect as often as I can, even between assignments or locations. I know it might be a little bit overkill, but like I was mentioning earlier, I'm a little bit um, susceptible to respiratory infections, and I might be in a little bit of a higher risk group because I have asthma as well. So, and I also know that sometimes I slip and I shake people's hands as well. But yeah, anytime I can wipe that stuff down or be a little bit more careful with it, I'm keeping certain things out of certain parts of my car so that I know that I'm maintaining a kind of a space that I can clean a little bit more easily, if that makes sense.
It does. So has the Chronicle instituted any like mandatory precautions? Do you guys have to wear masks or gloves, clean equipment a certain amount of time? Has anything like that happened yet?
Not yet. I mean, we've basically been told to maintain a distance from subjects, and also not to go into places where people might have, be testing positive. Shoot from a little bit of a, safe space, so to speak. And but nothing where we are restricted from doing our assignments or whatever. It's it's so fluid. I mean, it changes from day to day, and I think we just have to step up our own precautions. But being out and about as photographers, we don't have the luxury of being able to do our jobs from the security of our home, and so we have to just kind of like gauge the situation and be ready to kind of respond to it a little bit more carefully.
All right. Thank you so much. Paige, how has it unfolded in your newsroom? Are you guys undergoing required precautions? How has that progressed?
We haven't had any of I'll say the requirements of like wearing a mask. Actually, we've been told, unless you're in a very critical situation, not to wear a mask just because of the shortage. At this point now, if you are going to be going anywhere that has had considered a high risk area, say a hospital, interviewing someone who's tested positive, you have to get approval from an AME, managing editor. So higher up ranking, and they are the ones who are now weighing the the pros and cons of that. And certainly the handshaking has been a very kind of weird adjustment, but people are aware of it. We also found that during press conferences, especially in news briefings, people are very all up in each other's business. And at some point, the kind of main people who've been outside nursing homes, realized, okay, we can't do that anymore. We need to stay away, and we can all just shout. So that's been an adjustment too. But it hasn't been, I think, as difficult as maybe in other places because people here are so aware of it already.
Great, thank you. Kent, has your newsroom installed any new precautions or asked the staff to do anything specific?
We were given a list of things that, we should probably do on assignment. And I'll echo what everybody else said about, we're just a little bit more careful about how we go out into an assignment. But I've only worn my mask twice because I went into one area that it was a little suspect, and they were preparing food, so I realized that I probably should wear a mask, just to be conscious of the fact that I could be carrying. You know, I think we all have to be proactive like that, but mostly I don't. But I got to tell you, I have a system that when I go out on assignment, it doesn't matter what assignment it is. I get back to the vehicle, I wipe down the handle of my truck, get into the vehicle, I wipe down my steering wheel and my gear shift and everything else around me, and then I take another wipe out, another 2 wipes out. I wipe down every part of my equipment, both cameras. I'm just using 1 camera now. I was using 2. So I wipe down my wide and my zoom, and once in a while a 300. And I have a very deliberate thing that I do. So once I do that, I get back out of the vehicle, and I have bottled water and I have soap in my truck, and I wash my hands. And I don't just wash them, I wash them all over, and I wash up most of the time up to the middle of my my forearm. And I do that all day long, all day long, because, you know, I've got family. I don't want to infect, and I've got friends. I don't want to infect anybody, and I don't want to infect the people I go out to. But everybody has a little different standard. You know, I carry bleach with me. I even bleach the bottom soles of my feet. I take off my shoes before I get home, and I bleach the soles again after I walk. And then when I get inside, I take off my clothes. I know it's really risque. I take off my clothes. I put them in a bag. I take them to the washer. I dump them in the washer and sanitize all my clothes that I've worn that day. And I immediately go in, take a shower, wash down really well, you know, washing my body really well for the first part, and then washing my hair and my face. You know, you have to be just, you know, I'm super paranoid about it. You know, obviously you don't want to get it, but it's part of a responsibility of being a journalist, a photojournalist, is that, you know, you are in close contact with people all the time. And lens-wise is, I backed off quite a bit in my shooting routine. I'm shooting a lot more long stuff now than I was wide, and I'm maintaining that 6-foot distance. So I'm hyper aware that as journalists, we're considered essential. So we need to be able to go out and report these stories without getting ourselves sick and crippling our news coverage, and then getting other people sick. I think it's just something as a journalist that you just really need to do. And being hyperactive about it, I don't think it's overkill, really. I'm wasting a lot of stuff, but I'll tell you what, I feel good, and I feel good about how I clean myself.
Thank you so much. So I am now going to start going to some of the questions from people who are listening, because we have quite a few. So let's talk a little bit about self-care and support. What are you guys doing to take care of yourselves? What are your fellow journalists doing? Are you a part of Facebook groups? What are you doing to make sure that you stay healthy and sane so that you can keep working? Why don't we start with Carlos?
Well, that presumes a threshold of sanity that might have not been there to begin with. But you know, I call people, I talk to friends and family. I know that it's difficult to sometimes to, you know, go through something like this when your family might be at risk. My parents are both over 80. My mom's birthday was on Monday, and I couldn't even go see her. So lots of phone calls, you know, telling them it's going to be okay. I mean, I know that our responsibility is to be out there, and I know that we have to keep people from pushing the panic button. So it doesn't help if we push it first. But yeah, it's a matter of reading a lot of what's going on out there and sharing it with people and making sure that they understand that this is a valid thing to do. You cannot take this lightly, and there's so much material that we haven't been exposed to or haven't had, you know, given to us that we have to, you know, be the provider of that. And you know, you know, I'm somewhat of an introvert anyway, so you know, being self-isolating is actually normal for me. So I'm not panicking yet, but I'll be honest, I did have to call my doctor and ask whether I should be tested, because I started having some questions about, you know, some symptoms that I was having that I felt should be addressed, because I did come into first-person contact with a young woman who had to come back from Italy, and from near the area that was first first quarantined. I've gotten better, but I just didn't want to take a chance and don't want to be a vector for this at all. I don't want to put somebody else's life at risk.
Understandable. Thank you. Paige, what are you doing for self-care and taking care of yourself, unwinding to make sure that you get the rest you need?
Yeah, if one thing I've done is even just for an hour, not have any screens, not have my phone, not have my laptop. Even 1 hour, I got super anxious about it, but even just that hour really helped. Taking walks, I think, as journalists, especially now, we have a tendency to think of everything in names. And I found that I would be in my apartment and I would think, oh my gosh, it's the apocalypse, the world is ending, everyone's freaking out. And then I'd go outside and realize, okay, there are still people outside. Most of them are social distancing. The world is not ending yet. So that's really helped. And also hearing from readers and who are thanking us and kind of reminding myself of our duty and how we are one of the reliable places people can go to now. That's been really helpful as well.
Great, thank you. How about you, Kent? How are you staying sane and healthy during this time?
Oh, and it's really tough. I kind of echo what Carlos said. It might not seem like I'm a little bit of an introvert, but I do have sometimes I do have a difficult time getting started in the morning. Spend a lot of time alone. So basically, when I get back to my place, I put the phone down, and I don't read it for I'll probably a good 2 hours, and after I get all settled down and I eat, I just decompress from all that stuff. Last night was a little difficult for me because I was so busy yesterday, but I put the phone down, I put the computer down, and I turn on Netflix and I watch the comedy specials. I need to laugh. I found that I needed to laugh. And also a really good thing too is the walking. I mean, you really, when people got out, it was one of our nicer days here yesterday after days of rain, and people were there, the parks were jammed because we're all kind of sheltering in place, but people can get out and walk around. So it was really good to get outside, and even social distancing and talking with people, it kind of set a tone that, we're going to get through this. We know that there's a lot of businesses that are being disrupted, a lot of people's lives are being disrupted, but getting out and taking deep breaths and just kind of looking at your surroundings and realizing, yeah, we're in this, it's going to be deep for a while, but you'll come out on the other side and there's hope. I've always been that kind of person that's always been there's a lot of hope, because we've had so many wildfires here in Sonoma County. And we had one last year. We had a flood. We're in a perpetual state of disaster in Sonoma County. It's just, as a staff, we've gotten really good at it. So we've as a staff, we've really figured out that there is time that you just got to walk away from it. Your goal is to report as a marathon and not a sprint, and you have to live your life like that. And I've really had to, especially with this, really learn to really get my head out of my job when I get home, because it is really very, very tough to do that. Before I go to sleep, it sounds funny, but I hook up the computer and do those rain sounds and the waves and the river sounds, and it puts me right to sleep. It's great.
Thank you so much. So I have a question specifically for you, Kent. Jacqueline in DC says, can you explain how you apply bleach to your shoes a little more? Is it in a pan, wipes? How do you do it in the car? Could you explain your process in a little more detail?
I just, when I get out of my vehicle, I just have the Clorox, the pump Clorox, with the handheld one, and I just spray my feet. That's all I do. I just spray, the sides and the bottoms of the soles, and that's how I do it. And it's probably overkill, but you could have a pan of bleach, but I'm a little cognizant of not leaving that stuff out for animals and stuff. So I do that as I walk to my place, basically. and then when I get in, I take my shoes off, and I'll bleach them once more when I get in. But I feel like I'm a little bit of a maintenance person because I'm carrying Clorox around with me all the time.
Great, thank you. So Carlos, maybe you can answer this one, and the other two too as well. Are you guys still going into people's homes and interviewing them, photographing them? Has that changed at all in assignments?
In some cases, yes, we are. In other cases, no. And typically, if someone has said that they are being tested or has symptoms, we do not go into the home. And I was actually asked to go shoot an assignment up north in Ken's neck of the woods on somebody who was feeling that they had symptoms and couldn't get a test, and was specifically told not to photograph inside the home by my managers because they don't want us to get exposed. In other cases, when we're doing stories about vulnerable communities, we do go inside, but only when they've confirmed that they're not having any symptoms or any having any issues. I'm trying to maintain a distance on a personal level anyway, because I don't where I've been might I might have picked up something or whatever, and I don't want to bring that into somebody's home as much as possible. So it's a mixture. At this point, it's about having good judgment about where you've been and what you could potentially either come in contact with or put others in contact with.
Okay. Paige, are your journalists still going into people's homes? What is it like in Seattle?
We're really not at this point. I think even if we wanted to, people would probably be uncomfortable with that at this point. We're still photographing people at, say, like various schools that are giving out lunches for kids every day. So we're photographing that. Still photographing things that are happening, but actually in a home, I haven't really seen. There's been a lot of shooting from outside a window and taking photos that way. So it's definitely been us, but then also people who don't feel comfortable with that. And I've been doing a lot of like the 6-foot interviews too, where you kind of have to project to get your questions answered, which has been an adjustment as well.
Okay. Kent, maybe you can start us off with our next question. Is there anything you wish that had been done for your newsroom to be better prepared? Do you have suggestions for newsrooms who are about to experience this?
I would test. I would test everything that you have and make sure that, and do dry runs. It might take a little bit longer. It might add to your day, but here's how you got to look at it. When we cover wildfires, you just have to know that if it's going to hit the fan, it's going to hit the fan, and you got to be there for it. Now, with something like this, if someone gets sick in your newsroom and everybody's there, your newsroom's done. You're not going to be able to communicate with the public at all. You're not going to be able to get your newspaper out, and it'll go. I mean, we all work very closely together. We have budget meetings together. We have stand-up meetings together. We're touching paper all the time. We're touching computers. If one person gets sick, tests positive for COVID in your newsroom, then it puts everybody at risk. So you cannot you have to make sure that these test runs work great. And we've been pretty good about it because we've had so many disasters in the last 5 years that we've gotten really good about being remote and doing our jobs from our cars or from our homes. That's not a problem. But for the companies that think that they shouldn't, you got to treat it like you're going into sort of like a war. You got to take precautions, and you've got to be able to make sure that all your people are on the same page, that you get it ironed out beforehand. I highly recommend that. And you're going to have glitches, but I really highly recommend that you do 1, 2, maybe even 3 or 4 dry runs of this, because it's going to get there. It's going to get there, and you're going to have to work remotely. It's the only way to do it.
All right. Thank you so much. So another question, have any of you wrestled with new ethical considerations or issues as your coverage has changed during the pandemic? What have those ethical questions been, and how have you dealt with them?
I can start.
Okay.
I think, well, first I want to go back quickly to the last question. And one thing is that I think at the very beginning, our newsroom treated this as potentially there might be 1 or 2 cases. It's a one-off thing. It's one story. We're done. And if there's one case, there's going to be more. So acknowledging that if once it happens, it's not going to stop. It is kind of like a fire in that way. So yeah, when it starts happening, you need to just go because there's not going to be a lag after that probably. In terms of ethical questions, I think at the beginning, especially with Life Care Center in Kirkland, we were doing a lot of record searching and trying to figure out what had happened in that nursing home. And, you know, journalists are always sort of looking at, okay, who's responsible for things happening? And at the beginning, we weren't sure, well, these people are getting sick, but is this something that someone could have even stopped? We don't really know much about this at that point. So we certainly waited to publish anything that may have been critical of Life Care or any other nursing home until we could get more information, more context about how this works with the new virus and the outbreak. So some of the journalistic instincts of, you know, investigate and figure out who's to blame, you have to sort of reconsider with this.
Okay. Carlos or Kent, do either of you want to answer that question?
I can answer that. I think that I was really careful to try to stereotype the masking photos because of where the consensus that it started in China. And I've been, you know, early on they told us the face masks don't really work. It's, you know, if you're, you know, for trying to keep it out. If you're, you know, obviously if you're infected, you want to wear a face mask, you know, if you're around your family or whatever. But and so there was these stereotypical pictures of everybody walking around, especially Chinese, you know, walking around the face mask. And I had to really, and you know, I can credit the Kalish workshop for that because when I went, Danny and I and a bunch of other people, we all had these great discussions about stereotyping in your communities. And I've really kept that in mind when I've been shooting this. And I've really stayed away. And this morning I shot one at a store that opened up early, you know, because everybody's wearing them now. So you can't, but I have been very, and, you know, I've been very careful about that. And also on any story that we're doing, we're double sourcing, triple sourcing almost everything. We're trying to get confirmation on everything because we don't want to add to the hysteria that's out there. You have to make sure that your facts are correct before you do anything. And it's been solid and sane coverage. And, you know, it's going to keep going, and you just got to keep those channels open. You really do. I just don't want to be stereotypical with my coverage. And I think I've done a pretty good job. I think our staff has done a pretty good job of it.
Great, thank you. Carlos?
Can you hear me? Along the same lines as Kent, we're being very careful about, you know, who we photograph wearing masks, kind of not trying to leave a, you know, kind of a defining, you know, image of, you know, Asians wearing the masks all the time. So that you know, suggestion came from our editors about a week and a half ago, just to be aware of how we might be, you know, profiling certain races. The other thing that I've noticed as well is that this emergency doesn't have, you know, big visual, you know, warning signs. I mean, there's not, you know, huge amounts of smoke on the horizon. There's not rising floodwaters. There's not, you know, crumbling buildings that we normally cover. How do we photograph something, you know, show that it is different than how things were before, rather than it just being a daily part of life? I mean, the other day I photographed a single car going across the Bay Bridge, and you know, I sat up there and waited for 15, 20 minutes to see if the traffic was lower in general, and it was, from my experience, because I spend a lot of time, you know, working at night and know the traffic flows. But again, it's like, it's really unusual to see that, but people did ask me, well, was traffic just light to begin with? And I said, I felt comfortable enough saying that I've personally seen this at this time of night be a lot heavier. You know, there are, you know, and it's a good question because people, you know, want to know, is this normal? Is this natural? And you know, from my experience, you know, the answer is no. There's empty streets all over the place. I mean, California Street in the financial district. I mean, we're looking at the Embarcadero in San Francisco. Market Street is empty. I mean, we're talking about, I haven't seen those areas that empty since 9/11. And the bridge, I haven't seen that empty since they shut it down about 10 plus years ago to rebuild a section of it. So, you know, those are very distinct things that I visually can remember, and, you know, from my perspective can say this is different enough. But there are questions about other things we photograph, whether that is just something that we're seeing every day, or if it's related to the virus, because again, it's not, virus isn't something you can see.
Paige, did you have something to add?
Yeah, I'm just sort of going along with that. We're seeing a lot of call them parachuting journalists, often national journalists coming in. And there was a photo essay of scenes in Seattle, and there were a few like, look at this graffiti that is showing, like, you know, people are graffitiing the walls because they want to show that we're in a state of emergency. But that graffiti was already there beforehand, and it was about climate change from a year ago. So those sorts of things, you're right. Like, you need to have the context, or else you are sometimes, you know, fanning the flames. So that's a big thing too for anyone who is going somewhere that they don't normally cover.
Great, thank you. So another procedure question here. A couple of people have asked, are you changing how you're collecting your captions, using mics? Usually we're pretty close to do video and photo. Is there any new procedure there to make it safer to still be able to mic people up or interview them with multimedia equipment? No?
I'll go to that.
Go ahead, Ken.
Oh yeah, thanks, Carlos. You know, we don't normally do that here. I use my iPhone a lot for video. I do a lot of spot news video. But I can tell you that from what I've seen, people aren't getting mic'd up as much as they used to be. From just different interviews that I've seen online, people are still doing it. But I think that there's just a certain amount of precaution that you've got to take. You know, sticking a microphone on somebody right below their face that you've handled and then that they're going to breathe into. I think it's just, you know, you can use a boom mic if you need to, if that's your, you know, if that's your preference, or you can go in a room that's got a little bit of echo to it and you can probably get a little bit more sound out of it. But for the most part, I really don't do as much video from this as I have of other spot news events.
Great, thank you. Carlos, anything to add there?
Yeah, I haven't done much multimedia on this in the last couple of weeks related to the coverage, but I do have to change some of my my captioning, because I do use the recording option on the back of the camera, and I'm really hard of hearing, so I tend to lean in a little bit to listen to people and to repeat what they're saying, and I have to learn how to maintain my distance. I mean, I'm really. That's the one thing that I feel I'm kind of like really being sloppy about is, I lean in and listen to them pretty closely, and that's not a good thing to do. And I caution people to, maybe, have a notepad or even, something on your, it's tricky because you don't want to hand your phone to somebody who might, then contaminate your phone, or, a notepad that might contaminate. So I have to find a good way to do it. But the way I'm doing it now, I'm telling you as a warning, getting in closer is not the right way to do it.
Great, thank you. So I have a question from a student here. She says, I am in the yearbook for my school and we are going to cover it a year in a life. How would you cover, and where would you get your information from if you have any tips for a young journalism student?
Oh, me? That's a tough one because, everything that you're experiencing right now as a high school senior or, high school student is it's like you've been thrown into the spin cycle. We're doing a project on the class of 2020, our entire department is, and all of a sudden that got, not put on hold, but it's just been, just we don't know how to proceed with this, or we don't know how to, work with the students that are, now on not lockdown per se, but in social isolation. They're not going to school. And so there are stories there for you to really, approach. It's just hard because everybody is self-isolating, and you're going to have to do a lot more telephone interviews, finding out maybe the story is how are students, getting their last exams in, or their last, bits of their senior, classes that they need to graduate. There's so much to really approach from there. How are teachers finding ways to teach remotely, or, give students, the instruction that they need so that they can finish with all their necessary credits. There's a lot of stories there. It's just, you're going to have to kind of like think about how it affects your, your group, and then extrapolate from there. Are there students who have parents who are medical professionals? What are they going through? What's the sense or level of stress among, high school kids because their parents are stressing out? I mean, there's so much to really approach from a high school perspective.
Thank you so much. So, if any of you would like to answer this, do any of your newsrooms have plans with how you will cover the situation in which if hospitals start to run out of ventilators and needs exceeds supplies? Have you guys been talking to hospitals? Do you have plans in place for that?
The hospitals are already there here. They're asking for donations for masks, and they're actually asking people to help sell supplies for masks, and we're already at a critical shortage for everything. So our plan is just, at this point, oh my God, what's everyone going to do?
Okay, thank you. Kent, did you have something you wanted to add to that?
Yeah, we just ran a story today saying that in our edition today, that saying that some of the nurses and doctors are going to have to start using scrubs, cut scrubs out and make makeshift masks out of them. It's very much, for the breathing stuff and the ventilators. We're going to run out of ventilators if we have if we get more critical, which there's most likely that it's going to happen. Hopefully it doesn't, but yeah, we've been doing those stories for about a week now, and we've had a really, really difficult time of getting some of our hospitals to go on record saying what they have, and even saying how many people they have in their hospitals. I mean, it's just been very tight-lipped. It's very frustrating to try to get that information out there, and you're met with a lot of resistance, and people need to have a right to know what's going on in their community. But yeah, some of the nurses here are starting to complain that we're going to run out of stuff, and we're going to have to figure out, relatives are going to have to sew face masks and out of whatever they can find, so people can, because they're running out of them now. I mean, even gloves, they're running out of gloves too. I mean, probably not as bad here as it is in other places like Seattle, but definitely there's a lot of consternation in the medical profession here about what they're going to do if something happens. And the ventilator story, we've been doing that quite a bit too. I think it's a national story. It's been in every graph about how many people are infected, and how many people can recover if they have a ventilator, and how many people can't. So it's part of the national discussion, and it's a regional discussion also.
Thank you. Carlos, did you have anything you wanted to add?
There's something that might be on the horizon, which I think might be an interesting kind of like a Rosie the Riveter movement going on, where everybody is kind of pitching in. There's stories about how, the CDC is putting out plans on how to sew, little face masks, and that's something that everybody could pitch in, which to me was really interesting. Are there groups going to be getting together to do this? Are people doing it from their home individually? Recently, the Tesla Motors factory got into a little bit of a back and forth with Alameda County sheriffs about whether they should stay open, whether they shouldn't. And then Elon Musk came out and said that, well, we can turn the production line into kind of a respirator production and help with that shortage, just like GM did, just like Ford did. And so that's another aspect of, how are we, going to win this race to, getting all these extra respirators that we desperately need, because if the numbers are correct, we're going to be incredible, face an incredible shortage of that. So I think that's one way that we're going to probably try and cover it, to see if they can retool in time rather than just make the offer. They should have started yesterday.
Mm-hmm. Thank you so much. So we have a few questions here, which I'll try to combine into one. How do you guys think this will change our industry? How do you think it'll change our newsrooms? Will we go completely remote? Do you think it'll strengthen people subscribing? Do you think there will be more layoffs? How do you feel like this situation is going to change the future of journalism?
Our subscriber base has done very, very well. I think in the last month, it actually, I don't know exactly how much, but it was much higher. And in some cases, our page views have doubled, tripled, even 8 times what we normally would. But on the other side of the coin is that businesses are really hurting, so advertising is down. So I don't know how exactly that's going to even out, if we're going to be saved by the number of subscribers, or if we're going to be hit by the lack of advertising, which has been an issue for obviously a very long time. And as for the working from home aspect, I think at this point everyone's seeing that it can be fun for a few days, but I think everyone actually wants to get back to the newsroom. Even when we had the optional, there was a few days where it was optional if you could work from home, and there were people saying like, "Don't make me work from home. I will, kill my children. Like, let me come back." So I think people are recognizing, okay, there's something to be said for person-to-person contact, but it is interesting that we do know now that we can put out a paper when everyone is outside of the newsroom. So it might strengthen our options in the future, but I don't think that this is like the be-all, end-all, or I'm hoping it's not. I really want to go back to the newsroom and this traffic.
All right. Kent or Carlos, do you guys want to speak to that?
I can speak to that. Yeah, the same thing as Seattle, that, we're having a huge, our advertisers have really backed off. And we're being hit real hard. But on the other hand, as a journalist, I'm looking at our page views, and they're through the roof. And, we've had some big events here just in the past 3 years, and our page views are just going through the roof with people coming on and looking at it, because we've opened up our paywall like everybody else has for the coronavirus coverage. And but yeah, we're going to get hit hard. I think all media industries are going to get hard. Press especially, they're having a tough time anyway. But as far as working remotely, photographers have always kind of done that. But I do like that camaraderie that I get from a newsroom. There's a certain amount of it's a family. It's part of your second family. You just have to. You work so closely together, and I do miss that, because I like being involved in the daily life of a newspaper. But yeah, I think I think you're going to find the general consensus is that people are going to want to be around each other again, and we'll get through this. And like Carlos said, people are going to start chipping in ways that you didn't think was possible. And that's heartening to me. And as a community, especially as a community newspaper, you have to maintain that viability, that there's hope out there for people. And, being on the street and reporting those things, it brings hope to me. It brings hope to the readers that I supply material to. And we just all have to band together and look at the positive side of all this, if there is a positive side right now.
Thank you. Carlos, did you want to say anything about that?
Kent and Paige said about, numbers, and, right now we're seeing our digital subscribers climb, our views going through the roof. I mean, doubled in some cases, or more in some cases. We're still putting out the daily paper too, which is, which is decidedly trickier when you're all in different locations. I do think our digital subscriptions will stay high. I'm not sure if our imprint subscriptions will remain the same, because I think people are seeing how much you can get and how quickly you can get it from a digital subscription. Advertising is going to be an issue when there's so many businesses that might have closed down or have had to lay off. A lot of people are going to have to ramp back up to their normal sales. That's going to be tricky for them to be putting money into print ads. I'm not an expert in that, but I do believe it's going to, that's going to be a little bit of a roadblock for us to be, in the future. I've been around newsrooms since I was 8 years old, and I love the hum and the buzz of being around people who are all kind of like, pushing the train in the same direction. And I miss the newsroom. It's hard because I, had to, we work remotely as our norm, and to have, been out of the newsroom as much as we have been, as photographers for a while, all of a sudden I'm realizing now I can't have it, and that's kind of like the tricky part. There's still somebody there, getting our mail. We're still able to go back, but it's not the same when it's empty. It feels decidedly different. And I will miss it, until we get back together and have a nice big sheet cake, or election night pizza. That'll be, I'm looking forward to that again, to seeing my colleagues, because we all work together really, really well, and we've seen that through all the emergencies and disasters that we've had to cover.
Thank you. So we are just about out of time, and I just wanted to say, for anyone listening and also our panelists, we will be highlighting newsrooms. If you guys are innovating or doing new things that you think other newsrooms can learn from, please feel free to email me. And my email is Duncan, DUNCANK, at rjionline.org. We'd love to do more pieces, more panels on how we can help each other. And thank you to our panelists for joining us. If any of you would like to share your emails or handles, please do so now. There are still quite a few questions we couldn't get to, so I know people would love to know how to contact you.
Yeah, so I'm currently essentially quarantined in my apartment, so I have a lot of time to talk to people. My Twitter is at PG Cornwell, Cornwell. My DMs are open. That's the best way to get in touch with me.
Thank you so much. Kent, would you like to go next?
Sure. My Twitter handle is at Kent Photos. KENTPHOTOS, and Instagram is at KPPhotog, KPFOTOG. And my email is kent.porter@pressdemocrat.com. Pretty easy way to get a hold of me.
Thank you. And Carlos?
My Twitter handle is at CAG is me. My full name was too long to put into a Twitter handle. So that's one way to reach me. My email is cgonzalez, and that's with a Z at the end, at sfchronicle.com. And my Instagram handle is at Carlos Avila Gonzalez, again with a Z at the end.
All right. Thank you so much. Thank you to everyone who joined us. I'm sorry we couldn't get to all the questions. Feel free to email me or email our panelists, and we will do the best we can to answer anything we didn't get to answer. Everyone have a good day and stay healthy.
Wash your hands.
Bye.
You have a good day.